So good afternoon everyone. I'll be presenting on effect of anti-VEGF treatment on micromorophometric parameters in chronic CSC and pachychoroid neovasculopathy. So chronic CSC, gravitational tract with a stipple fluorescence and variable amount of SRF, as we can see in these pictures. So pachymetry, pachychoroid neovasculopathy, and it's referred as CSC associated CNVM. In OCTA, in this picture, we can see a non-invasive visualization of lurking PNV and with the same sensitivity as FFA. So my objectives and methods, outcomes of the training chronic CSC and PNV with anti-VEGF injection in terms of visual acuity and OCT, NFAS, OCT and OCTA parameters. So prospective interventional study in January 2020, June 2020, which are RIB approved, and we have used the BCVA as a log mark, FFA, ICG as baseline, OCT, OCTA baseline and follow-up OCTs. SRF height is measured, SRF area on NFAS OCTA, flat irregular PET, that is FIPED, hypo and hyper fluorescence and network on OCTA. So in both groups, the off-label intravitreal bevacizumab, that is IVB 1.25 milligrams, was injected at the baseline and for 6 months. And then we have started a PRN treatment for 6 months. So PRN regime and re-injection if the SRF height reduction is less than 100 microns. So the outcome studies were done at the end of 6 months. So the result in chronic CSC PNV are as follows. The number of eyes in chronic CSC are 30 eyes of 28 patients. In PNV, 30 eyes of 29 patients. And the mean age is 52.6 to PNV 59.4. And the p-value of male and female is less than 0.001 in both. So mean follow-up days in chronic CSC is 172.12 plus minus 35.7, and PNV it's 184.32 plus minus 2.182. So in chronic CSC, 13 eyes, and after mean duration of follow-up of 8.6 months, the SRF height reduced significantly from 213 and at the base to 43.5, and the SRF volume also reduced from 0.9 to 0.1 at final visit. So my conclusion is SRF area as a reliable parameter to monitor the quantum of fluid in PNV and chronic CSC as an SRF area reduction are in parallel to SRF height. Bevacizumab is an efficacious treatment option in chronic CSC, and significant improve in BCVA and reduction in fluid can be achieved in chronic CSC with fewer injections than needed in PNV. Thank you.
You're asking something?
Nothing in specific.
No, I wish to find out why do you find that the effectiveness of bevacizumab is different in PNV and CSC?
So mostly the SRF height is reduced, and the area of SRF is significantly reduced in chronic CSC than PNV, sir.
What is the mechanism of SRF in chronic CSC and PNV?
That's actually
Okay.
not the scope of study actually.
Good, thank you.
Okay.
Thank you.